Welcome to Radquarters. Today we'll be talking about ultrasound of intersection syndrome, which is a friction tenosynovitis about the wrist. I'm Dr. Dan Koval. This episode is sponsored by Samsung Ultrasound. The beautiful ultrasound images you're about to see were obtained on an RS-85 Prestige ultrasound unit. We're going to review examples of both proximal and distal intersection syndrome, highlighting key teaching points throughout. Let's start with some anatomy of the wrist extensor compartments. So here we're looking at an axial MRI image of the wrist. There's the radius and the ulna. And at the top of the screen, we have the dorsal side of the wrist. At the bottom of the screen, that's the ventral side. So on the dorsal side of the wrist, we have 6 extensor tendon compartments. But for intersection syndrome, we only have to worry about the first 3 compartments. So moving from compartment 3 to compartment 1, compartment 3 just has one tendon, that's the EPL, the extensor pollicis longus. Compartment 2 has 2 tendons, the extensor carpi radialis brevis and the extensor carpi radialis longus. Compartment 1 also has 2 tendons, the extensor pollicis brevis and the abductor pollicis longus. To help you remember this, you can see that as you go from compartment 3 to compartment 1, the tendons alternate. So you have longus, brevis, longus, brevis, longus. And also there's this little bony protuberance there at the dorsal side of the radius. You can see that's in between compartment 3 and compartment 2. That's known as Lister's tubercle. So that's a useful ultrasound landmark, and it's also helpful when dividing up proximal and distal intersection syndrome. Now let's look at an ultrasound case. This was a patient that presented with a history of a distal forearm lump and pain after snow shoveling with some decreased range of motion. So here we're scanning in transverse or short axis at the level of the dorsal distal forearm at the proximal wrist. And you can see here's the radius. Superficial to that, we have the ECRB and the ECRL tendons. These are both compartment 2 tendons. And then notice how there's another tendon that's crossing over. And we actually see the musculotendinous junction of this compartment. There's the muscle as it transforms into the tendon, crossing over compartment 2. And at the side of the muscle, we also see some heterogeneous hypoechogenicity indicating edema and some fluid surrounding these compartment 2 tendons. If we turn long axis at this musculotendinous junction of compartment 1, you can better see that muscle edema there appearing heterogeneously hypoechoic. And when we add color flow imaging on this region, here we're using MV flow, which detects slow flow in small caliber vessels, we see that there is hyperemia throughout that edematous muscle, indicating neovascularization. We can often better appreciate this on real-time imaging, so here we're going to be moving proximal to distal in short axis. This is the ulnar side, and the right-hand side is the radial side. Again, there's compartment 2 here, and we're going to see compartment 1 crossing over. There's the edematous myotendinous junction. There's the fluid surrounding these compartment 2 tendons. And again, there's the radius deep to these tendons. So we've got this peritendinous fluid and edema at the site of the proximal intersection. Findings typical for proximal intersection syndrome. So this is an overuse tenosynovitis, and tenosynovitis is inflammation of the tendon and tendon sheath occurring secondary to repetitive friction. And it's a non-infectious inflammatory change at the site of this intersection. And with proximal intersection syndrome, we're focusing on the musculotendinous junctions of the first wrist compartment. Again, that's the EPB and APL, where it crosses the tendons of the second compartment, the ECRB and the ECRL. And that intersection occurs about 4 to 8 centimeters proximal to Lister's tubercle. So if we look at this frontal radiograph of the right wrist, that's about where Lister's tubercle will be located at the distal radius. And these 2 tendons correspond to the compartment 2 tendons, the ECRB and the ECRL, and you can see where they insert onto the bases of the second and third metacarpals. So note that we have these 2 tendons crossing over, corresponding to the EPB and the APL. Again, that's compartment 1. So this crossover is the site of proximal intersection syndrome. So this is a normal physiologic crossover, but it becomes abnormal when a patient engages in repetitive extension and flexion activities. Typically, it's seen in patients engaged in rowing, skiing, racket sports, horseback riding, weightlifting, also mountain biking. When it becomes inflamed, patients will present with radial forearm or wrist pain that worsens with extension and flexion. And on ultrasound, we'll have tenderness to sonopalpation at the intersection site, and we'll also see peritendinous edema and fluid. So again, if we place the transducer right at this intersection site in a patient with proximal intersection syndrome, we'll see this peritendinous fluid and edema. All right, now let's take away those extensor compartment 1 tendons. We'll leave compartment 2, and let's look at another tendon. So here we have the EPL tendon. That's also headed out to the thumb. And where do you see this tendon crossover? Well, this is distal to Lister's tubercle, and this is the site of distal intersection syndrome. So this is less commonly seen than proximal intersection syndrome, And again, it's where the third compartment tendon, the EPL, crosses the second compartment tendons, and that will be located distal to Lister's tubercle. Now let's look at a patient with distal intersection syndrome. We place our transducer right over this intersection at the level of the carpal bones in transverse. This is what we'll see. So note that there's some fluid surrounding that ECRB tendon and more pronounced heterogeneously hypoechoic fluid surrounding the ECRL tendon, expanding that tendon sheath. Again, these are the compartment 2 tendons. Let's turn on long axis and note the tendons as they approach their metacarpal insertion sites. We see this fluid as well as some synovial thickening surrounding the tendon, again more pronounced about that ECRL tendon. Now let's focus a minute on that extensor carpi radialis longus tendon. If we add color Doppler, we see that there is hyperemia within that expanded tendon sheath, and that's further brought out with the addition of MV flow imaging. If we turn back short axis, we can see this marked hyperemia, this inflammatory neovascularization about that tendon sheath. Now here, if we look at that on real-time imaging, this is a short axis view of compartment 2. This is the radial side, the left-hand side of the image where we have the ECRL tendon. The right-hand side of the image is the ulnar side, that's the ECRB tendon. So as we move proximal to distal, notice that a tendon is starting to cross over these compartment 2 tendons, and this is the EPL tendon here, so that's compartment 3. And notice that as it's crossing over, we have some fluid surrounding that ECRB tendon, also the ECRL. As we move a bit distally, that fluid is more pronounced about both the ECRB and the ECRL tendons, and we can continue to follow this tenosynovitis as the tendons approach their metacarpal insertion sites. So a nice example of distal intersection syndrome where compartment 3 here is crossing over compartment 2, and that's where we have the inflammatory tenosynovitis. So just to summarize those two sites of intersection, the dark blue tendons, that's compartment 2, which will be deep to these crossover tendons at compartment 1, where we have proximal intersection syndrome, and compartment 3, where we have distal intersection syndrome. And treatment for intersection syndrome typically involves rest, activity modification, splinting, and anti-inflammatory medications, but if symptoms persist, corticosteroid injection or even surgical release may be required. All right, I hope you found that educational, and thank you so much for joining me. Thank you to our sponsor, Samsung Ultrasound. If you like this lecture, a great way to support us is to subscribe to the video podcast on Apple or Spotify, or by clicking the YouTube subscribe button. To see bonus teaching material posted throughout the week, follow us on social media. You'll find links in the show notes, or you can click the YouTube posts tab. Until next time, radiology is life.